I shared with the group that was on a few moments ago that today's conversation will be specifically talking to California schools, but for those of you that are from anywhere else in the country, today is an opportunity to really get prepared for the changes that may come to you at any point in the future. So with that, I think let's go ahead and get started. For those of you that are just joining us, my name is Chris Joffe. I'm the founder and CEO of Joffe Emergency Services, and we started in 2007 with this goal to create and to foster safety. And believe it or not, we actually started just with the goal of doing that through response training and event safety. And so things like CPR and first aid training and providing EMTs and paramedics both at events, and also staffing school health offices so that whether a nurse was already in place or even for schools that don't have a nurse at all, that our EMTs or our nurses could actually be on-site resources for those schools. And in some cases that was part-time, in other cases it was full-time, and we basically took on the role of the school nurse. But as we grew and over the last several years, we've found that schools needed a lot more than just that CPR training or just that health office coverage. And so we've grown into the role that schools truly do need. And we do disaster preparedness consulting, and so looking at big emergencies like fires and earthquakes and lockdowns and hurricanes, and looking at small emergencies too, like when somebody doesn't belong on your campus but shows up and they're not necessarily a threat, but they either don't belong there or we don't know that they're there. And then we also look at sort of individualized emergencies. So that's where the healthcare side of our work really comes in. And today we're talking about immunizations, which you would think wouldn't be all that big of an emergency, but believe it or not, for some schools, based on the rates of students that are immunized versus not, this is actually a crisis. And for some of you, and in fact I know just a couple of you that are with us today already, the concern is that some of your students may actually leave in an attempt to find a school that won't hold them accountable or expect that they meet the needs of this new law. And so whether you're one of those or you're a school that's just looking to stay compliant and make sure that you're doing everything that you're supposed to be, you're in the right place. And so today we'll talk specifically about immunizations, about the changes in the law, this concept of the SB 277, and we'll talk first about how it came to be and how immunizations became so controversial and so challenging, and how they came to be. And then we'll talk a little bit about what's happened over the course of the last 2 years that's caused this to be the emergent time. And finally, then we'll talk about what you should do about it, and we'll give you some strategies and some resources. I'm excited to have Sherlee on with us today from Magnus Health, a partner of ours. And I said this earlier, but it's probably best that I let Sherlee tell us a little bit about who she is and what Magnus does. And so I'll kick it over to you, Sherlee, to just say hello and welcome.
Thank you. Hi, my name is Sherlee Johnson. I'm the Chief Operating Officer of Magnus Health. I'm pleased to be joining the personal use technology to make the world safer. And at Magnus, we specifically are a software company that provides electronic health records for schools, and we work with primarily the school nurses and athletic trainers to manage the student records, health records primarily, but we see it as being a file cabinet for them for whatever their needs may be as far as managing records electronically as opposed to all the paper that used to come in.
Excellent, thank you. And it looks like there's a little bit of feedback coming in about Sherlee's audio, so Sherlee, as we get started, maybe we'll make some adjustments there. So thanks very much for the questions and the feedback coming in about that. So let's get started. Let's talk a little bit about how this came to be and what's going on here. Again, today's conversation is really based on this law change, and the bill is officially called SB 277. So for those of you that have heard that term, it refers to the change in law surrounding the immunization policy in the state of California. Before we jump in and we actually start to uncover some of the mysteries and some of the challenges that are associated, I'd like to give you just a quick poll, and I'd like to find out from you how well you understand the changes that have taken place. And so the categories that I find that most schools fall into are below. One of them, and perhaps the scariest, is what? Wait a second, the law changed? And so if you're in that category, now's the time to share it. Don't worry, it's an anonymous poll, but also it's know that you're not alone. And in fact, we'll share the results of the poll with you because you are not alone, and there are a number of schools that are in the same boat. There are also a number of you that know it changed but don't really know what to do yet. Some of you that sort of have an idea of what we're supposed to do, some of you that know, and then there are a number of you that know so much that you could actually be leading this webinar. And so we'll put that poll up for you in just a second, and we'll invite you to share your feedback and your thoughts on where you are. And there's that poll for you. So on your screen, go ahead and select one of the following. What the law changed? I know it changed, but don't really know what to do yet. You kind of have an idea of what you're supposed to do. You know what to do, and then you know so much you should really be leading this webinar. And incidentally, feel free to select that one, and we might even invite you to share a couple of words with us. All right, and let's go ahead and see what you said. Awesome. So there are a number of you that are in the you kind of know what to do, and in fact that would be my guess if I were to sort of guess where you fall. I'm thrilled to hear that everybody knows that it changed, and I will tell you that when we had this conversation last, it was the beginning of August, and the law had just changed not very long before that, and there were about 60% of the population that were on that webinar that didn't even know that the law changed. And so obviously there's been some really good progress there, and I'm excited to hear that. It looks like a number of you do know what to do, and so that's excellent, but that you're all falling in that sort of mid category. So nobody's 100% there, and a number of you need some support. And so that's about right. And for those of you that are in any of the three categories that are on the screen in front of you, you're on the right call, you're on the right webinar, and we'll get you to advance at least to the next layer there. And we'll actually ask you this question again towards the end of the conversation today. So let's go ahead and dive in. Our goal today is that essentially that you, after the webinar, are able to articulate the changes in law, understand the timeline for changes, that we talk a little bit about the PBE Student, and we'll talk specifically about what that is, that you're able to create messaging that appropriately informs but also empowers your community, and that you can manage parents that sit on the polar opposite sides of the fence. And one of the challenges is that there are still a number of parents that sit on the side of the fence that say we can't immunize because it has side effects and risks and things like that. And there are a number of parents on the polar opposite side, and they say, well, you have to immunize because without that it's a danger to my student or my child or to our community. And the challenge is that neither of them are really correct, and neither of them, or I should say neither of them are 100% correct, but neither of them are 100% incorrect either. And there's a lot to understand about how those positions were sort of formed, and how they became thoughts and how they truly became sides. So we'll talk through those, and the goal is that after today's conversation that you can really effectively have a conversation with parents on either side of that fence. So putting this into context, we started this conversation because in the state of California, there are a number of organizations that are absolutely required to be immunized. And I'll get rid of that pop-up there. And so the law specifically applies to all preschools, all early childhood centers, all daycares and babysitting facilities. And what's interesting about that is that it doesn't just apply to daycares truly, it does apply to babysitting facilities, meaning that there are these homes or other facilities where anywhere from 5 to 35 students or children might come just to be sort of watched for the day. And it may not be an official quote-unquote daycare, but it's considered a babysitting facility, so those as well. K-12 schools, and that's where the majority of you are from. And it also applies to post-secondary schools. So there are some laws that are specifically associated with those as well. How did this start? Well, in 1998, a doctor named Andrew Wakefield created and published a paper in The Lancet, which is a British medical journal, and it specifically cited that 8 children who had developed autism had been immunized and within a month had actually displayed signs and symptoms of autism. Now, whether you believe in the paper or not, the paper was redacted a little while after, and the reason for that was multifold, and we'll talk a little bit about that in just a second. But the immediate reaction as soon as that paper was published was that vaccination rates in both the UK and in the US dropped. And by dropped, I mean they bottomed out. They got very, very low. In fact, the lowest that they've ever been since immunizations have been adopted by sort of Western medicine. And over the course of the last 15, 16 years or so, they've certainly increased. We've gotten to a point where we have more students immunized than we did in certainly 1998, in 1999 and 2000. However, we're still at a point where a large number of students are not immunized because of the fear of autism and some other spectrum-related disorders. This gained a lot of traction and became sort of a public McCarthy got on board, and love her or hate her, she got on board, and she has certainly a large and well-heard voice. And so her concerns were vocalized, were shared, and almost immediately the folks that hadn't heard anything about this study jumped on board with it as well and said, you know, we've got to make a change. We can't immunize anymore. Having a little bit of trouble taking back the next slide. There we go. So how did the study get published and why was it redacted? The study said that for all intents and purposes that these 8 students these 8 children all developed autism within a month or showed the first signs of autism within a month of the immunizations, and the opponents of the study very quickly raised the concern that there were no control subjects in place. And so in the 1990s, when autism was at a relatively low rate at the beginning of the decade, and it was increasingly getting higher and higher over the course of the decade, and it continues to grow. I don't know what the exact statistic is this year. It was recently published, but one in somewhere around 90 to 150 children are likely to develop or to show signs of autism. And so again, whether you believe in the disorder, believe in the categorization or the study, there's no question that the numbers of people who have acquired autism and spectrum disorders have increased. And that was going on in the 1998 period. And so the opponents of the study say, well, it's not possible that, or rather it is possible that all 8 of those people who developed, all 8 of those children who developed signs of autism were going to develop them anyway. And because there wasn't a control subject in place, and because that's a necessary component of a scientific experiment, especially one to be published in a medical journal, the paper was redacted. And when it was redacted, there were a number of opponents that jumped in and said, well, a number of different things. So there were financial ties associated, and that's the reason that the paper was redacted. We talked about the control subjects, and then what's happened since 1998 is that the theory or the concept that autism is linked to immunizations, specifically the immunizations that we're talking about today, has been overturned or proven incorrect by a number of different scientists, both in the UK as well as in America. So fast forward just a little bit. Again, in 1998, this all began. In 2014, 15 rather, end of 2014, early 2015, the measles, a disease that has been essentially eradicated in the US for many decades, came back. Between January 1st and February 21st, 2015, there were over 120 cases that were found, primarily in California, but they were found in other states as well. And the current operating theory is that the quote-unquote outbreak began in Anaheim. And for those of you that aren't from California, Anaheim is known as the home of the happiest place on earth, Disneyland, and that is indeed a possible genesis of this outbreak, or quote-unquote outbreak. Over the course of the last 16, 17 years, we've developed this program, and it's called PBE, and what that stands for is personal belief exemption. And the concept behind that is that if a child or a family decides that immunizations aren't the best decision for that child or for that family, that they can fill out a form. They can have that form documented and signed by a physician, and then that child doesn't need to be immunized. And there are a lot of there's a lot of gray area, and has been a lot of gray area in what qualifies for a PBE, what is a PBE, who's allowed to have a PBE, who's allowed to sign off on a PBE, and that gray area is basically what's being taken away as of January 1st, 2016. So the old law said that if a child had a religious exemption, so they were part of a religion that recommended against or believed against immunizations, they had a medical condition, so they were somebody who had either HIV or perhaps Crohn's disease, primarily autoimmune disorders, but really any sort of medical challenge that would be exacerbated or challenged by immunizations, then those students would also qualify for a PBE. And finally, there was a checkbox on there that said, for all intents and purposes, I just don't want to. I truly have a personal belief against immunizations. And so for any of those three reasons, a student could have a PBE filled out. They could be unconditionally admitted into kindergarten, first grade, seventh grade, and so on, or into a daycare center for that matter. And as a result, there were some parents that were unhappy because the numbers certainly did plummet. I'm going to pause for just a second, and I'm interested and always curious in this question. And the question is, it will be a poll question, so in just a moment you'll see the poll come up on your screen. But my question is, based on the information that we've shared with you, and based on the background and some of that sort of leading up and how we got here, do you feel that it would be beneficial for your parent community to have a webinar similar to this, perhaps led by us, perhaps one that we created and was led by you, that sort of addressed these challenges and talked a little bit about the history and how this came to be? And so we'll put that poll question up for you here, and there it is. And it looks like the end of it chopped off, so I'll go ahead and read it to you again. The question is, would you feel it would be beneficial to you if we held a webinar similar to this that you could invite your parent community to participate in? And the reason that we would offer it or the reason that, at least to me, it seems most logical for you to offer it to your parent community would be to provide a sort of neutral voice and or an external third-party voice. And depending on your community, one or the other might be more beneficial. But in an effort to sort of take away from the thought that the school might be attempting to impose this, and to help parents understand that this is truly a mandate. And so I'll give you just a moment to answer that question for us. And while you're answering that question, it looks like, Melanie, I see your hand up, but if you could go ahead and share your question with us in the question box there on the right-hand side, then we'll go ahead and answer it for you. All right, and we'll go ahead and pull that poll down, and let's see what you said. All right, so it looks like just under half of you said yes, so that's something that we'll take a look at. We've been rattling around some different ideas at Joffe to try to help schools help their parents really understand what these laws are and how they impact them and how they impact their children. And so it's great to hear that feedback. So that's something that we'll more than likely share with you by email in the next couple of weeks, and we'll share some opportunities, some specific dates, and perhaps a structure for how exactly that will work. So thank you so much for that feedback. That's excellent. So let's go ahead and hop back in. And as we hop back in, I'll share with you sort of a personal story. And um, some of you that are on the call with us have heard this story before. But in January of 2015, it was perhaps the hardest time to be a safety consultant, I might say, ever. And there were a number of reasons for that. And I'll say that between about January 11th, I believe it was, and January 25th, I had something to the effect of 200 conference calls with schools across the country about how this quote-unquote outbreak was a danger and what to do about it and how to manage it and how to manage parents and students and everything else that goes along with that. And so I kid you not, it was perhaps the most challenging time that I've ever had personally and professionally. And one of the things that I learned during that time was the importance of every word in the communication that surrounds an incident like this or a quote-unquote outbreak like this. And for a long time, we've supported schools and businesses too with and on their sort of crisis communications. But what this really taught me is that this was enough to identify it as a crisis and to truly adopt and to utilize crisis communications. And so for those of you that either were on a call with me and or were on a call with somebody else from our team, you certainly more than likely remember how challenging that was for you too. And so there were a couple of things that I found particularly important to share with you. And the first was that we had this immediate sense of panic. As soon as the first case was diagnosed, and it was diagnosed in Southern California, there was this big panic nationwide about where that child was, whether or not it was possible that somebody else had contracted the disease from any number of different venues, either on a flight with the child or by touching the same roller coaster or whatever the case may be. There was this word, quote unquote, outbreak, and whenever we have a health-related concern, it's easy to jump to the term outbreak, and certainly the media did, and for all intents and purposes, it was. But one of the things that we talked about a lot was that it was important to restrict using the word outbreak, or if it was going to be used, to at least put quotes around it, because it's something that immediately causes panic within our parent community. And that panic leads to, for all intents and purposes, a witch hunt. And what basically happened in January of 2015 was a publication was put out through a number of different media channels. So for better or worse, I believe at this point that either all, if not very close to all, major media sources in Southern California, Northern California, and New York have published these articles that specifically talk about the number of students that are immunized at each school. And there's an initial sort of question as to whether or not that's confidential information and things like that, but for better or worse, it is public information. And so at the beginning of each year, either by October 17th or October 1st, depending on what school you're working with and what age group you're working with, you turn in these records to the Department of Education and or to the Department of Public Health, depending on what state you're in. And those records say X number of our students have been immunized against these several diseases, and we'll go over what those are in just a moment. And then the state, depending on what organization, somebody from the state reviews those, assesses those, and either comes out and says, hey, let's have a conversation about your numbers, or hey, no problem at all, or in some cases, they don't even get back to you. Either way, as soon as those records are submitted to the state, they are considered public information. And because we're not reporting names of students, it's legal and it's appropriate for it to be public information as far as the law is concerned today. Now, whether or not that you believe that or whatever the case may be, as far as the law is concerned, it is considered public information. So what happened is that we found these studies that said, well, this school is 80% immunized, or this school is 20% immunized, and many schools sat somewhere between 75 and 90%. And what happened was the 75 to 90% of families who were immunized, or families of children who were immunized, began to, for all intents and purposes, start a call chain and try to figure out who wasn't immunized and try to put some pressure on them to get them immunized. And again, as far as the law was concerned at the time, the school didn't have the ability to impose a mandate, and the families certainly didn't have the ability to impose a mandate, but there was the possibility of quite a bit of, for all intents and purposes, bullying and pressure and things like that. And that is indeed what we saw at many of our schools. And what that ended up doing is putting a lot of undue pressure on the families that were not immunized, families of children who were not immunized, putting a lot of energy, and parents tended to put a lot of energy into trying to run this witch hunt and figure out who wasn't and force them into immunization and things like that. And so it created this sort of contentious relationship between any vocal parents of students who weren't immunized and any vocal parents of students who were. And for a number of our schools, that confrontation was pretty violent or ugly, violent in language, not so much in actions, but became a very challenging and tenuous situation for either the head or whoever it was at each school that was sort of tasked with that to manage. And so our involvement in that situation is always as the third-party consultant to say, here are the facts, here's what you need to do, and this is it. It's a fact of the matter issue. Where many schools struggled was sort of managing that opposing and potentially confrontational voice that kept coming back and forth, and also limiting the amount of control that parents had to communicate to each other for all intents and purposes. So again, January 2015, very difficult time to be a school safety consultant. Very, very happy that the measles quote-unquote outbreak is done and gone. But it did lead to this conversation, and it very much is a part of the reason that this SB 277 is being discussed today and is now law. And let's see if I can advance to the next slide here. SB 277 says that children must be immunized against all of the diseases on the screen. Now, I won't read each of these to you, but measles is certainly on here, as is chickenpox and whooping cough and some of the things that you would expect. And each of these diseases has been eradicated in some capacity, some not 100%, some not truly gone. But each of these diseases have been managed by way of immunization for a number of years, most of them 35 or longer, 35 years or more. Chickenpox is one that still exists today, and I don't know that we'll ever be rid of truly, but certainly it's one that can be immunized against, and the immunization is considered relatively safe. Now, the law says that children must be immunized against each of these and can be immunized by whoever the family chooses. So it doesn't need to be a specific doctor or a specific type of clinic or anything like that. It frankly doesn't even need to be a pediatrician. It can be anybody. But when they deliver that immunization, that it must be in accordance with the regulations of both federal and state government. And so there are some specific rules and policies that go around how immunizations are given and how they're documented and things like that. So long as they're delivered by an actual doctor at an actual doctor's office, clinic, or whatever the case may be, they're going to be considered compliant and okay immunizations. That being said, some of the immunizations on the screen in front of you, measles included, have a number of different doses that need to be delivered. And so, for example, the measles has 2 or 3 doses depending on the type of medication that this child is receiving. And each of those doses has a specific time frame within which it's supposed to be delivered. So some might be delivered before the child turns 18 months old. Others might be delivered before the child turns 2, 4, 6, or 8. And so depending on the type of immunization, the student, and for some of you, the state, those regulations will be in place, and those will be made available after today's conversation. But every disease that's on this list in front of you must be immunized against for each student that enters your school. Now, the question that I often get when we start talking about this is, well, does this still apply to us because we're an independent school? And the answer is yes. Then I get the question, does this still apply to us because we're a daycare / ECC, or we're considered a preschool and not an ECC, or any number of other things? And the answer is yes. Head Start school, daycare, independent school, public school, religious school, and so on. Each and every school, each and every environment where there are going to be 10 or more students and 2 or more staff or faculty members in place, this does apply to us. Again, public, private, secondary, childcare, universities and colleges and community colleges and so on, these laws do apply, and the SB 277 does specifically call out each of those organizations. Now, the rule says that a pupil or a student can't be unconditionally admitted unless they've been immunized. And I'll talk a little bit about one exception to that rule, but they can't be unconditionally admitted unless they've been immunized, meaning if they haven't been immunized yet, at the beginning of the year, and perhaps they're at the cusp or they're right before the age range at which point they must be immunized, we can still bring them in. We just need to conditionally admit them. So put differently, if a student is 2 years old and is coming into our ECC and has not yet received their third measles immunization because it's not appropriate until they're 2.5, that's more than fine. We can unconditionally admit them, and then when they're immunized, that documentation should be turned into the school. We can notify the health department or the Department of Education, depending on what state we're in, and all is well that ends well. That being said, if they have passed the age limit at which point they're supposed to be immunized, again, those regulations can be found after this webinar. You're always welcome to give us a call to find out what they are specifically for your state. Then they're not going to be able to be admitted unconditionally or conditionally into our school. So, and I'll pause for just a second just to remind you that that question box is there on the right-hand side of the screen. And so I certainly invite you to begin sharing questions with us, questions that are either challenging you about this law or questions about whether or not this applies to you, etc. You're certainly welcome to share those with us. And in just a moment, I'm going to turn it over to Sherlee to share with us how Magnus can actually help track immunizations and some of the programming that goes along with them. That is, if I can advance to the next slide. Here we go. So I mentioned earlier that the PBE used to exist and used to be in place for a student who either was whose family was either opposed to immunizations because of religion, a student who could not be immunized because of a healthcare challenge or a medical issue, or frankly didn't want to. And as of January 1st of 2016, a PBE will only be accessible for students who are not medically able to receive the immunization. So for the first question that I often get when we start talking about that is, well, what does medically able mean, and is there any gray area there? Is there any wiggle room? And in short, medically able means that they don't have a virus or a disease that would actually be exacerbated or could be otherwise contributed to by an immunization. It means that oftentimes students or children who are receiving a lot of medication for any number of other either diseases or disorders, sometimes behavioral, sometimes medical, they may not be medically able to receive the immunization because it would conflict or could conflict with the different medications that they're on already. And so students that you're likely to find that are going to have PBEs are going to be students that are childhood cancer patients, students that have Crohn's disease, students that have HIV, and diseases like HIV or immuno-challenged diseases are oftentimes going to be the most restrictive when it comes to immunizations, because a lot of immunizations, in fact, I'll say most immunizations are delivered, or the purpose of them is to deliver a small amount of the virus or the bacteria or whatever it is that we're immunizing against into the body and allow the body to build up this resistance and things like that. Well, somebody who doesn't have an immune system that's capable of fighting even a small amount or building up the immunity to it obviously can't get even a small amount, or else it can be very life-threatening for them. So students that are, again, either childhood cancer patients, students who are Crohn's disease patients, students who have HIV or AIDS, students who perhaps are autistic and parents may delay them a little bit or have so many medications going on in the early years that they feel that it's appropriate to delay them. Those are going to be some of the students that you'll find that have this PBE that's considered PBE medical. Now, inevitably, there will also be students who have no medical issues whatsoever and also have a PBE medical. And so there will be physicians, and again, whether you support or don't support the idea, physicians will be out there that will sign PBEs that are not for any grounds or not on any grounds. And so if you're, again, depending on whether you're on the pro or against that side, it doesn't necessarily matter. What does matter is that if the student or the child can produce a PBE, that we honor that PBE. And it's not our job at the school level, and it's not our responsibility at the school level to try to identify why the PBE exists or whether or not it's valid or anything like that. So long as it has a physician's signature, it's not a forged document, we're able to accept it, and we need to accept it. Now, this law changes on January 1st, 2016. What the law allows us, though, is about 7 months of wiggle room, well, 8 months of wiggle room. So for students that you have on campus today, or for students that you have on campus that join your campus before January 1st, so before the end of this calendar year, there's no implication or there's no challenge to the PBE that's already in place. So if it's a religious PBE or I just don't want to PBE or a medical PBE, there's no follow-up research or follow-up data assessment or anything like that that will take place until the beginning of the next school year. So as of September of 2016 or August or whenever your school year begins, that will be when the first cycle hits where you actually need to receive the PBE. The PBE form will change. It will only have the medical exemption box written on it. And at that point, no student can be unconditionally admitted unless they've either achieved all of those immunizations or have a PBE. So that's a lot to try and digest. And with that, for just a moment, I'd like to turn it over to Sherlee, because for many of you, the challenge is not just whether or not a student can be admitted, but it's also how we manage the records, and that's really where Magnus Health comes in. And so I'll turn it over to Sherlee to talk with us for just a moment about how Magnus Health helps you manage the records, helps manage the immunization charts in general, and can help support you as you begin this process.
Thank you. Well, at Magnus Health, what we do is replace the paper records that schools normally have that the parents send into the school nurse and or whoever the administrator is. And what we have is a software solution. So we have what we call the file cabinet, in which the papers are submitted, or we try to use electronically signed documents where we can. So we no longer even use the papers. We work with the schools to actually implement the software solution, and only forms that have to be signed by the physician at this time are the ones that have to come in and be uploaded into the system. But what we are able to do, we manage the immunization records. We can either have the records stored on the software and reviewed by the school nurse, or we also have our own nurse reviewers that are assigned to the schools and who are responsible for reviewing the immunization records as they come in. And they also are looking at the expiration dates. They're looking at the next they're actually reviewing them to make sure they're compliant, that they have the right numbers of immunizations, that they're on the right track as far as the times, and we give them notifications in the event that they're not on track, or they're haven't met the requirements of the state. And we do this in every state.
Excellent. Thank you, Sherlee. And so just to recap, if you're a school that doesn't have a school nurse in place, or you're a school that is struggling with trying to manage all of that data at the beginning of the school year, in addition to just the sort of core technology offering that Magnus has, there's actually that resource of a person to help review and to help manage that process. And so we have a number of our schools that are health aid schools, where we actually have a school nurse or a person who functions as a school nurse who's staffed on site for the school. And even in some of those environments, it's more efficient and easier to have Magnus help with the processing of all of that data. So a number of different options available there. Now, there's this concept of grade spans that goes around or is involved with this law. And before I actually talk about what a grade span is, I'll share with you a little bit about how it applies. So next year, in order for us to unconditionally admit a student, they must have either been immunized against all of the diseases that we shared with you earlier, or have a PBE for a medical reason. And again, this is specifically in the state of California. Now, if in the event that a student is in 4th grade and has already been unconditionally admitted to the school, they don't have to make any changes or make any modifications in order to enter 5th grade. Or if a student's in 1st grade, they don't actually have to make any changes in order to enter 2nd, 3rd, 4th, or 5th. And the reason for that is that they've been unconditionally admitted into that grade span. And so a grade span, for all intents and purposes, and as far as SB 277 is concerned, is considered birth to preschool, kindergarten through 7th, or depending on the state that you're in, 5th, 6th, or 7th grade, whenever middle school kicks in, and then high school. So if you're in preschool or in an ECC, the student can actually advance within that program until they transition to the elementary school. And if it's a student that's in elementary school, they can actually advance within that program until they get to middle, and so on and so forth. So if you've got a number of students that you feel like is really high that have not been immunized, and they're all in, let's say, kindergarten this year, you're actually going to be okay for a few years because nothing has to happen for them in terms of changes in what they can do or what immunizations they can or can't have until they get into the next grade span or into middle school. So again, it's birth to preschool, kindergarten, and or first grade, depending on your setup, through middle school, and then high school. And so you're allowed to have that little bit of wiggle room. And so for all intents and purposes, for the next 5 to 7 years, we'll still have some of these challenges that will surround us, and we'll still have some of the challenges with parents seeking out students who haven't been immunized, and so on and so forth. So although it is a process, and this process certainly has begun, we won't be to a point where we have true resolution for at least a few years from now. So what changes for this year? Again, and this was an interesting conversation to have at the start of the school year, nothing. So we don't expect or need anything different this year. We don't expect that, and nobody does, the state doesn't either, doesn't expect that there's a major change that happens until the start of the school year for you next year. So if that's in July, August, or September, depending on the regular start date of your school, that's the first time at which for any student entering a new grade span, and again, the grade spans we shared with you, and you'll be able to see this webinar after the presentation, so you'll be able to see what those are if you've lost them. But for a student who enters that new grade span, that will be when the changes take place. So if you have an ECC, a kindergarten, or 7th grade, and you reported in October as you were required to, you're good to go. You've already done what you need to do. You actually don't need to do anything again. Next year, when you go to report, the process will be very, very similar. You'll still log on to shotsforschools.org, or shotsforschool.org, and you'll enter the data. The difference will be that those two options, both religious and just personal belief, will be removed, and so the only option that you'll have to enter for a PBE will be because of a medical reason. And so there's nothing that you need to do or jump on today, but that certainly will be a major change that's represented for next year. As of next July, again, the PBEs will only exist for medical exemptions, will apply to all students as they matriculate through the process, and will essentially limit the number of PBEs that you're receiving just by sheer logic. If there's only one way for a student to be qualified for a PBE, the number of PBEs should be slightly less, if not significantly less. So I'd like to take just a quick second and ask you how we did. If you could take a moment, we'll put this poll on your screen here in just a moment, but take a moment and share with us how you feel and what you feel like you gained from today. And the questions are actually exactly the same questions that we asked you at the beginning. The difference is obviously this webinar. And so we'd like to take just a second to say, how are you feeling? What changed? And do you feel like at least at this point we've advanced you through to +1 for all intents and purposes, so to the next phase? And we'll give you just a moment to share that feedback with us. All right, and let's see what you said. Awesome. All right, so we're to a point where at minimum, most of you have a general idea of what to do, and so that is definitely exciting and encouraging. We're at a point where 0% of you, literally none of you on the phone or on the webinar today, are at a point where you don't know what to do. At least everybody kind of has a general idea. Many of you, it looks like, are at a point where you know what to do, so that's excellent and certainly is helpful to know. Thank you for that feedback. In just a second, it looks like there are a number of questions that have built up, so in just a second, we'll go ahead and begin to answer some of those questions. And let's see here. In fact, as I say that, we'll go ahead and begin to answer some of those questions right now. Melinda, can you go ahead and share those questions with us, or with me?
Okay, can you hear me okay?
I sure can.
Okay, we have a 3-year-old who currently has a religious belief PBE. Are they required to be immunized before the next school year? We live in California.
Great question. So thank you for that. And um, the answer is relatively easy so long as there are clear boundaries for when the student sort of matriculates and goes into kindergarten. And so basically as a 3-year-old, there's nothing that they need to do next year because they're within the preschool grade span. But when they turn 5 or go into kindergarten, they'll need to then be either immunized or get a PBE that says medical exemption. Again, and this is one of those challenging things because there's such controversy around it, but there are doctors that will inevitably write prescriptions and PBEs and the like for students that are not truly medically exempt from immunization. So be aware of that fact. I wouldn't suggest that you encourage it, but I would offer it to you as a little bit of information and a way to feel really comfortable saying go get a medical PBE or get your child immunized. Great question.
Okay, so I think Rachel asked, I mostly know what to do, but still have some questions. Can students be conditionally admitted if they are on a delayed immunization schedule?
Good question. So long as they, and incidentally, for any of you that are in that category of, I mostly have a concrete idea of what I'm supposed to do, I know what I'm supposed to do, but I just have some general questions. Obviously, you're certainly welcome to ask them now. You're also welcome to share them with any of our consultants, and at the end of this conversation today, I'll share with you a venue to do just that. But for that specific question, so long as they are going to meet their numbers or they're going to meet the deadlines for themselves prior to the deadline occurring. So put differently and put in English. So long as they're going to get immunized before the deadline, and for different shots that's at a different point, then yes, they can be conditionally admitted. That said, if they're on a delayed schedule, as in the doctors offered or opted to push them back several years, then there will need to be a medical exemption written for that, a PBE medical, that says that we've elected to hold them back, and here's why, or not for that matter, but we've elected to hold them back, and I'm signing off on that as a physician. And at that point, then they can be unconditionally admitted. Great question.
Okay. Our elementary school is grades K through 5, and middle school are grades 6 through 8. Is the grade span grade 6 through instead of grade 7?
Great questions. So I would, in general, you're safe to use the blocks of your elementary, middle, and high school for your school. Now, the next time that you're going to have to report, or the grades that we have to report to the Department of Education or the Department of Health, depending, are going to be kindergarten and 7th grade. And so it's possible that although you generate the data and although you have the information for your 6th graders, that that's not actually reported. Put differently, because it's not reported, you might have a little bit more wiggle room on those than you would if it were reported. But the grade spans are going to be best used if you sort of identify them within your school and use the grades that make sense, elementary, middle, and high for you.
Okay, there's another question that's similar. I'm not sure if this is the same thing. Once a student enters a new grade span, do they need to have all California required immunizations since birth, or only the grade required immunizations, for example, such as DTaP, TTAP at 7th grade, or only the grade required immunization?
Good question. So the Tdap or DTaP, depending on which one you refer to it as, they're for all intents and purposes the same thing. Those types of shots have, I believe it's 5 separate immunizations that need to be delivered, and depending on the specific type, there may even just be 4. So those only need to be administered by the deadline for the child or for all children. And so for that in particular, by the time they get into 7th grade, they really should have had all immunizations. And so that means that, yes, they wouldn't be able to be unconditionally admitted unless they had had all of those dosages. But at the same time, if they were in kindergarten, for example, they only need to have the number that they're required to have at that point. And we can share a list of those with you, certainly, so that you have a little bit of an idea of what to do with those. Great question.
And then the last question is, I think I can answer this, is it possible to access this recording later or at another time? And the answer is yes. The recording will be up later today.
Awesome. All right. And by the way, Melinda is somebody that you don't often get to hear, but she certainly is a part of every webinar that we do. So thank you so much, Melinda, for sharing those questions with us and continuing to make these webinars so great.
You're welcome. I'll go back behind the scenes again.
So with that, and those are some great questions, one of the big challenges that we find, again, is not so much knowing the information, but what to do with the information. And particularly in the state of California, where so many schools don't have a school nurse, it can be difficult to figure out whose responsibility this is. Is this the registrar, or is it the front desk, or is it facilities, or is it the business office? Whose responsibility is it to manage this type of information? And Sherlee and her team are certainly excellent resources for this. And so if you're a school that doesn't have a school nurse, or you're a school that does, and you just need some support and somebody to help run through the data and get this stuff done, Magnus is certainly an option. If you're a school that doesn't have a school nurse or is looking at adding to your school health team, a school health aide may be the option for you, and so we can certainly talk about supporting you either short-term or long. For a number of schools, they've said, you know, we want some help at the beginning of the year, so why don't you send us somebody for 3 months, get us started, and then our regular health team can take over from there. And so if that's an option or something that you're looking for or you're feeling like would be helpful, certainly let us know. But no matter what, we want to invite you as a way of saying thank you for being on with us today, and thank you for being on with us throughout this entire series, really, to take part in this school safety assessment. And the school safety assessment is about a 90-minute conversation with one of our sales consultants and offers you the opportunity to not only go through each and every item on campus, but also to sort of uncover some of those things that perhaps you haven't thought about lately. So what does your emergency notification system look like? What do your immunization numbers look like? And what's your process in place? What are your fire drills and your earthquake drills and your hurricane drills? What do those look like? What kind of supplies do you have on campus? And things of the like. And so we'll chat that link out to you now, and it's the link on your screen as well. But go ahead and click on that and just share your information with us, and what we'll do is have somebody reach out to you today or tomorrow. So after this webinar, because of the number of you that are on here, we'll do this very, very quickly and ensure that we get that assessment set up for you quickly as well. It's a completely free assessment, and the end result is that we'll share a presentation with you about some areas of improvement for your campus, as well as really pat you on the back for the areas that you're doing well at. I have had schools that have called and said, we don't want to have an assessment because we're afraid that we're going to have all of these things that are uncovered, and no matter what, we'll uncover some things, but no matter what, and this is still true today, and I hope that I get to continue to say this, but every assessment that we've ever done has also resulted in some really impressive work and sort of a productive and successful stance by the school on at least one of the categories that we assess. And so we always get to say, hey, you're doing at least one thing well. And for a number of schools, we actually get to say, hey, you're doing all 13 of the things that we're assessing for well. So we'll chat that out with you. In fact, it looks like it's already in your chat box. So go ahead and share that with us, and we'll get in touch with you today or tomorrow. The next conversation, or the next piece of this conversation, is that if you have questions for us, we'd like to invite you to share those with us, and you're welcome to send those to schools@joffeemergencyservices.com. And in doing so, one of our team members will be able to get back to you within the next couple of days to help articulate some of the challenges that you may be having, and to help sort of ensure that we get you move forward and get all of that information out to you. And finally, Sherlee and her team are available as well. And so if you have questions for Magnus, or you're curious about what an electronic student health and wellness database might look like, certainly we invite you to reach out to them, and you can do so, and we'll put that email address in the chat box for you here as well. Finally, after each of these conversations that we have with you, we like to invite you to take part in a survey. And so help us understand what works for you, what doesn't work for you, what do you want more of, what do you want less of, and share those thoughts with us. And it looks like we just chatted that link out for you. It's a very, very quick survey. It should take you 30 seconds or less. But if you wouldn't mind, just share with us how we're doing, and also share with us any topics that you'd like to have us cover in the future. So in the next couple of weeks, we're talking about some pretty exciting things. We've got business continuity coming up in a couple of weeks. We'll be talking about how to prepare your specific teams, search and rescue and first aid, and some of those disaster teams that we talked about earlier this year. We'll be really drilling down and actually doing a webinar for each team that you can ultimately share with them as a training resource. But certainly you'll be able to ask questions on those as well, and we'll be able to help articulate some of the unique challenges that some of you may have. But share with us any of those types of questions that you may have, and share with us any of those topics that you may like us to cover, either in that survey or by emailing us at schools@joffeemergencyservices.com. So with that, I'd like to say thank you so much to all of you for being here. Sherlee, thank you so much to you for being here. And as always, we can't wait to see you on next Thursday's webinar. We do this every Thursday at 10 a.m. Pacific and 1 p.m. Eastern, and so we just can't wait for next week. And we'll see you soon.